The Gift of Numbness, A Journey Through the Ages of Anesthesia. Part 3, The Age of Chloroform and Ether. Ether had a competitor, chloroform, discovered almost simultaneously but on the other side of the Atlantic. Chloroform gained popularity for its less irritable smell and quicker action. Queen Victoria even used it during childbirth in 1853, legitimizing anesthesia in the eyes of skeptics. But these early anesthetics were not without risks, such as chloroform could cause cardiovascular depression, which is a sudden and severe lowering of blood pressure that could even really lead to fatal cardiac arrhythmias. Liver toxicity. Prolonged exposure to or high concentrations of chloroform could lead to liver damage. Respiratory depression. Like many anesthetics, chloroform could suppress the respiratory system, sometimes fatally if not properly managed. Carcinogenicity. Long-term exposure to chloroform has been linked to an increased risk of cancer, though this was not known during its early use. Difficult to titrate. The therapeutic window, the range of dosages that are effective without being harmful, for chloroform was narrow, making it difficult to administer safely. But ether had its problems too, such as flammability. Ether is highly flammable and explosive, which poses a significant risk in operating rooms where open flames might be present. Prolonged induction and recovery. Ether typically had a slower onset and longer recovery time compared to other anesthetics. Irritation. It could irritate the respiratory tract, leading to coughing and laryngospasm, spasm of the vocal cords. Nausea and vomiting. Postoperative nausea and vomiting were more common with ether anesthesia. Challenging administration. Ether is less potent than other modern anesthetics, meaning that larger volumes were needed, which made it cumbersome to administer. Despite these drawbacks, the introduction of chloroform and ethyl ether revolutionized surgery and paved the way for the modern anesthetics we use today, which are far safer and more effective. However, the limitations of chloroform and ether were significant enough to propel continued research into finding better alternatives, eventually leading to the development of the array of anesthesia options we have now. If you enjoyed this video, come back for more. Hit that like button and subscribe.